Hello, and welcome everyone to our Croi Connect series, where we aim to answer your questions that you might have about cardiovascular health and also lifestyle-related questions. This week, we are here with Sarah Molloy, and Sarah is a coronary care nurse at Galway University Hospital, and she's also our lead instructor here at the Centre for Lifesaving Training at Croí House. Thank you for joining us, Sarah. You're very welcome.
Good morning, Patricia. Thank you, and thank you for having me.
You're very good. We're going to dive straight in here with some questions because we've got lots to get through, if that's okay. So you're working up in CCU, and a lot of our callers are wondering, what's it like at the moment, Sarah, in the CCU?
Well, just to reassure people that, everything is steady. And we really are encouraging people with any emergencies to dial that 999 and get to us as fast as possible. And, with all we're seeing on television, with the masks, the gowns, just to reassure people that, there will be a very human touch behind all of that. So please, please come to the hospital in an emergency.
Great, thank you, Sarah, because we're here on radio and across social media that people are being advised not to delay in attending hospital if they are experiencing urgent heart symptoms or stroke. Are people delaying? Is this happening? Are you seeing this?
Well, Patricia, we would be very concerned, the people might be delaying. And, our advice is that, delaying can really affect the long-term outcome. And again, to reassure people, Patricia, that, when they look at, the risk of infection and all of that, that infection control is always a very integral part of our training at work. And with the COVID, we've all upskilled. So absolutely everybody they meet. And from the time that 999 call is made, people are risk assessed straight away. So right through their whole journey to hospital, their whole experience, from the paramedics to the porters, cleaner, all through the staff that they meet, we are well prepared to protect them.
That's really reassuring, Sarah, really good to hear. So I'm going to get straight into the questions now, because somebody has contacted us and they want to know, what do they do if they're having symptoms, or if somebody with them is having symptoms, what should they do?
Okay, so the first thing is recognizing the symptoms that might, be a heart attack. And that is the most serious thing. And the first thing we all think about is pain. So I'm going to put in some alternative words for pain, because these are the experiences we have from people. I want to think of alternative words like squeezing, pressure, tightness, burning, because often patients will say to us, when you're talking to them, and I'd ask, what was the pain like? And they'd say, nurse, I didn't have bad pain, but I had terrible pressure. So we really respect that, as that is the patient's feeling of their experience they're having. So the pain can come right up through the chest. It can be through the back. It may not be through the chest at all. So this burning, pressure, squeezing, tightening through the chest, through the back. It can come up through the neck, out through the jaws, down the right or left arm. And, we respect that everybody's pain. Another little word of caution as well, Patricia, is diabetics, particularly as they get older, they can develop cardiovascular symptoms, and they may not feel pain as much being the primary symptom. So just to be very, very aware of that. And also we know that women, particularly younger women, often don't experience maybe the clear-cut pain, and they can be more of the other symptoms. So the other symptoms we look at are breathlessness, and sometimes people may be more breathless than anything else. Often, nausea, vomiting, weakness, all of those things. And another thing that is often underestimated as well is that terrible fear, a feeling of, real doom, and that needs to be respected. So if anybody recognizes or sees any of those symptoms, we really want to act on them fast. Another word as well that is used with pain is the patient will say, you know, I thought I had indigestion. And that is very common. But what we will say is indigestion is generally relieved with an antacid. And if people are having pain that increases with exercise and relieves with rest, they really need to be having that discussion with the GP so we can clarify, is it indigestion or could it be cardiac? So they are the main symptoms.
Thank you, Sarah. And you know, people often, they undermine those kind of symptoms. They think that maybe it is just indigestion. So what should, you know, you hear of people lying down or going back to bed for a while. Should they do that?
No, absolutely not. And particularly for family, or if somebody is on their own, please be reassured that there is help at the end of the line 24/7. So the first thing we will tell you, if you're on your own and experience any of those symptoms, do not delay. Dial 999 immediately. You know, we've heard of, you know, people might say, I might go and lie down for a few hours and see how it is in the morning. You know, it's 3 o'clock in the morning. I don't want to bother my family. I don't want to bother anybody. We have a saying in cardiology, and it's time is muscle. And what we mean by that is, if an artery is blocked, that coronary artery feeds the muscle. The muscle will start to die if we don't get it open. And that affects the long-term recovery and outcome. So, and even if your relative doesn't want you to call the ambulance, you know, go into another room, call the ambulance. Your gut feeling is very important about your family. You know them best. Call the ambulance. And our paramedics are absolutely excellent at dealing with distress. And if somebody's distressed when they arrive to the house. So dial that 999.
Thank you, Sarah. That brings us nicely into the next question that has come out. And that is, you know, what happens when the ambulance arrives? Can you talk us through what the process is like?
Okay, and this will emphasize, you know, why we should call the 999. So in Ireland and right across, you know, the world, there is a pathway for dealing with heart attacks. Now, for the layperson, we call it, you know, the National Heart Attack Program. In medical terms, we call it, medical nursing terms, the Code STEMI program. So this is what happens. From the minute you make a 999 call, the responder at the end of that is immediately alerted that this is a risk of a heart attack, that this could be a heart attack. An ambulance is already on the way to you, even as you're talking to the emergency responder. The second that ambulance arrives, they will do a 12-lead ECG, a tracing of your heart. And that is immediately electronically transmitted into our coronary care unit. So at whatever time of the day or night, that will give us a different alarm to all the other alarms. So we're alerted to it straight away. It equally goes to the cardiology registrar. He immediately, on looking at that ECG, will make contact. The paramedics and the registrar will discuss the ECG, discuss the patient's symptoms. And based on that, the patient is transferred as an emergency straight to our cath lab. No going through A&E. Once there is a clear-cut heart attack on that ECG, the team is alerted, and literally within 30 minutes, we have a team ready and assembled and waiting for that patient. So when the patient arrives in, you'll have a cardiologist, you'll have a cardiology registrar, you'll have electrophysiologist, you'll have a nurse, and you'll have our radiographer. So everyone is there ready, and that is absolutely normal. So the faster, the better. And it's really to reassure people that, you know, this is available 24/7, so don't delay. You're protected from the minute you make that 999 call.
That's hugely reassuring, Sarah, and people will be very reassured by that to know that the team is all ready and set to go. So then what happens? Are people admitted? Because I've a query here from somebody and they're wondering, like, with the coronavirus at the moment, does that mean that they won't get admitted? Or if they are admitted, you know, are they at risk of getting coronavirus?
Okay, so just to reassure people, they are treated exactly the same. The only small difference is we make that risk assessment for you and your family. You know, has anybody been in isolation? Has anybody been in contact? It makes no difference to the care. All it makes a difference to is whether you'll see us wearing a little bit more masks and gowns and that is purely precautionary from the time the ambulance arrives until we get you right through. The treatment is exactly the same. We are all the same behind those masks. Nothing changes in your treatment. So please be reassured, nothing changes. Straight through into the cath lab, around to coronary care, and the exactly same treatment. You will be protected all the time. And, you know, with all the infection control measures we have, your risk of picking up anything is really minimal.
That's really good to hear. Another question now, again, based on the coronavirus being with us is, you know, if something happens like that, an emergency, can my family come in with me? Can they visit? Am I going to be there on my own?
Okay. So again, to reassure people, you know, we have to do the risk assessment and make sure that, you know, the family member isn't a contact, that, you know, they don't have the virus as a visitor. In the acute event, when somebody is very unwell, we will let somebody in briefly for about 15 minutes. After that, according to the hospital policy, you know, our visiting is restricted, but that's to protect everybody. But just to reassure family and relatives that we're in daily contact with them over the phone, and we will keep reassuring them. And if there is any concerns, you know, our cardiologist or our nurse manager, you know, may you know, contact relatives to come in. But generally, we really restrict the visiting if we can.
Thank you, Sarah. Another question, and it's just a general question, really, I suppose, is people are wondering, how long do you have to spend in hospital if you do come in like this with a heart attack?
Okay, on average about 4 days, and then all going well. Now, sometimes people may need more tests. It doesn't necessarily mean that they're more unwell, but they just might need, from the first angiogram, they may need more tests, but generally 4 days.
I have another question here sent in to us from one of our volunteers, and they're asking, you know, they said that some people collapse with a heart attack, they hear, or is this something different?
Okay, now, again, people can collapse. And I suppose, you know, what I really want to emphasize here is, again, the reason for the emergency call. In the early stages of people having a heart attack, there is a risk that they may have a cardiac arrest. And that is where literally it means heart stops. And that is an immediate emergency. And that's why we want to get people to hospital fast. So what happens is, if somebody becomes unresponsive, you know, straight away you're going to check them, are you okay? If they are unresponsive and not breathing normally, and I really want to emphasize the word not breathing normally, we define this as cardiac arrest. Immediate 999 call, and we need to start CPR on this person. Anybody that is unresponsive and not breathing normally, it is cardiac arrest. And the faster we can get the emergency responses here, the better. And of course, again, that emphasizes why we need to get them to hospital quickly.
Thanks, Sarah. That kind of answers one of my next questions as well. You know, if somebody is not breathing properly, what do I do? So you've answered that really, really well. But what about giving breaths, you know, the mouth to mouth as part of that resuscitation? Could somebody catch coronavirus?
Okay, so again, the guidelines that we have is if you're out in the community and somebody collapses, you know, there is a risk if you do mouth to mouth. So therefore, what we advise people in the community to do is to do compression only CPR. However, if it's a loved one at home and, you know, children, infant, adult at home, it's a loved one, by all means, if you are trained, compressions and breaths, okay, because you can measure that risk. But in the community, compression only CPR until the paramedics arrive.
Okay, thanks, Sarah. So the next one actually ties into that, because this person has said that they are a community first responder. So should they still use the AED safely if they're the first to arrive?
Yes, immediately, the minute the defibrillator arrives, turn it on, put it on, and follow the prompts. Absolutely use the defibrillator.
That's great. Good, good. Now, you hear on the radio, and you've mentioned that, you know, heart attack can be a cardiac arrest, but that you can get a cardiac arrest as well. And you hear on the radio a lot of warnings now about accidents at home, and farm accidents in particular. Lots of people at home and everything now. So what do you do if you find somebody collapsed with maybe a cardiac arrest, as you've described, maybe from drowning or electrocution?
Okay, and I suppose the first thing to say here, Patricia, is that your own safety is always paramount. You are not going to be able to help this person if you become a victim yourself. So just stop for a few seconds and think. And the first thing to do, you know, if somebody is drowning, whatever, is dial the emergency services straight away and take their guidance. But from a point of view of electrocution as well, you do not go and touch that victim until you have turned off the power in the building. But, you know, there is a little guide to people, you know, at home. Do you know where to turn off the power? In your work area, do you know where to turn off the power? So there are little things we can do in a preventive mode, that if something did happen, we know how to respond. But your own safety is paramount, and then intervene and make sure that you pass on the information when the paramedics arrive as to what the mechanism of collapse might have been, so that you can pass on that information to them.
Thank you. That's really good, you know, sound advice there. My next question is about choking. So they've said here that they've heard of the Heimlich maneuver. So this is for choking. How's that done, or should you do that?
Absolutely. So the Heimlich maneuver is an excellent maneuver in the removal of any blockage of an airway. And first of all, when we're talking about the Heimlich maneuver, I just want to define the ages for resuscitation and for doing the Heimlich maneuver. So I will demonstrate it actually. I brought some mannequins and I will demonstrate that for you, because it's often the best way to see it. So an infant is from 0 to 1 year of age. A child is defined as from 1 to signs of puberty. And anybody from there up is classed as an adult. And if you're unsure, always, you know, between a child and an adult, always class as an adult. So we would perform the Heimlich maneuver on an adult and on a child. But for the infant, it's always back slaps and chest thrusts. So would you like me just to show you on the mannequin now, Patricia, the position for the Heimlich maneuver and how it's done?
That'd be really useful. Yes, Sarah, if you can.
Okay, because I think it's the best way to demonstrate it. So if somebody is choking, the first thing you need to do is, you know, go up to them, recognize that you're with them, okay, and that you can help them. Immediately, you need to get behind them and tell them you're going to help them. And this is what you do. Put your foot between theirs, put your arms around them. Landmark the belly button. So find the belly button. Now make a fist with your other hand, bring it in just above the belly button. Thumb, can you see thumb to the belly? Just there. Lock onto it with the other hand. Now pull in and up, until A, you expel what's in the mouth, or B, they lose consciousness. If they lose consciousness, it is now cardiac arrest. Straight to 999 and compressions on the chest. And just to show you, as I have the adult here in front of me, compressions are done on the lower half of the breastbone, right in the center, on the lower half of the breastbone. Heel of the hand, up good and tall, you're kneeling over them, good and tall, the heel of the hand, the other hand on top. We always say that the heart is the size of the owner's fist. It's right behind the breastbone. So the faster you get on compressions, the better. So that is the adult when they're choking. Okay, now I will just demonstrate on the child. So you still perform the Heimlich maneuver on the child. This time you would kneel down behind them because they're smaller. Again, finger on the belly button. Fist just above. Lock on and in and up, good and firm, until A, you expel what's in the mouth, or B, they lose consciousness. The second they start to drop, it's 999 and commence compressions. Now, it's different for the infant. With the infant, it's back slaps and chest thrusts. So you see how I have picked up this infant? Head down, over one arm. So I have a good grip of this little infant because it might be kicking. It's going to be very frightened. Now I want to perform back slaps very high across where the arms just go into the armpit there, very high because their little airway is very short. So 5 back slaps, 1, 2, 3, 4, 5. Cup the head, baby over, and exactly where you would do CPR, just below the nipple line with 2 fingers. 5 presses, over again. Now, if that baby starts to go any way limp in your arms, it's cardiac arrest, and you proceed with CPR on a table. So they are, I hope you were able to see that and pick up that, but if somebody starts choking, intervene quickly with the Heimlich maneuver on the child and the adult, back slaps and chest thrusts on the infant.
Thank you, Sarah. That's really, really informative, really good advice. And your demonstration makes it very clear for us as well. Just to close now, can I ask you what your key messages or your key tips would be for people to stay safe?
Okay, Patricia, so I had a few of them, all right, just to tie everything in that we've said there. So I'm actually going to read them out to you, I don't want to miss out on anything, and they are important. So the most important thing is, don't delay calling for the ambulance. You know, help is here 24/7. And to remind people, when they dial 999, it overrides any poor reception. So don't let that bother you. Indigestion could be cardiac. Have that discussion with your GP just to be sure that the pain you might have been having may be indigestion, but it could be cardiac. Please print out your postcode. In the early hours of the morning, if you have to make a 999 and you're asked your postcode, you may not remember. There's lots of young people at home at the minute. You know, get them to print out a postcode, give it to their elderly relatives, put it on the fridge, put it by the phone, anywhere at the back of people's phones, because, you know, it will be very helpful in an emergency situation. Always supervise children and infants when they're eating. Make sure they're always in your view when they're eating. Little children and infants actually choke very silently, so they need to be in your visual. Chop up grapes. Grapes are, one of the risks, particularly in little children, for cause of choking. So just make sure that they are supervised. Respond to the sound of silence in children. 99% of the time, if children go silent, it's mischief. But that 1%, they could be in trouble. So please respond to it. A choking that collapses is cardiac arrest. Nothing else, straight into dealing with cardiac arrest. And in an unresponsive adult, if they've gone unresponsive to you and they're gasping, that is not normal breathing. Immediately be alerted, this is cardiac arrest. Dial 999 and commence compressions. And if it's a loved one and you know how to give breaths, carry on. And finally, we are very conscious of all the safety message that's going out with the coronavirus and all the advice and rightly so, is to stay at home. But please, if you're showing the signs of a heart attack, a stroke, or any emergency, do not stay at home. Dial 999. Come into us. Thank you, Patricia. I think they're all my helpful hints, and I hope they really help people.
That's really great, Sarah. Thank you so much for joining us at Croi Connects today. We very much appreciate it, and stay safe yourself.
Lovely. It's been a pleasure. And to all the team there as well, Patricia. Thank you.
Thank you. So Croi Connects returns in 2 weeks' time. So in 2 weeks' time, we're delighted to have Trish Galvin join us. Trish is the Advanced Nurse Practitioner in Stroke Care at Galway University Hospital, and she will be here to answer your questions on the warning signs for stroke and also the best advice for stroke survivors. So if you've got those burning questions, get them into us right away. You can visit croi.ie or you can call us on 091 544 310. Don't forget to stay tuned to our website. We've got lots of great resources there. Follow us on Facebook or Twitter or Instagram, and you'll find us at Croi Heart Stroke. So thanks for watching. Stay safe. Bye-bye.